Hello, ladies and gentlemen. My name is John Farrow. I am the host of TikTok's Questions from Quora. Now we bring you Questions from Quora. YouTube edition. Can I go to the ER for shingles? Now, the most important thing to remember is that the emergency room is there for you when you feel like whatever is happening to you is too much. So, if you feel like your shingles are too painful or the vesicles are shedding or whatever your concern is, if you feel it's too much, that's what the ER is there for. Now, aside from that, the Center for Disease Control says that there are a variety of antiviral medications that can be given to decrease the length of the infection and the severity of it. On top of that, shingles is a severely painful disease. CDC says that it can be treated with over-the-counter medications, and in some cases that's probably true. However, in a lot of cases, we're going to need to establish IV access, and then you're going to need IV pain medication to help control the pain during the most critical periods of it. Now, on top of that, shingles can be transferred when the wounds are open. So when you're in the hospital, they're able to dress and use proper infection control to help stop that spread. If you have a primary care provider, PCP, it's best to contact them. They may want you to come into the office and prescribe medications. They may want you to go directly to the ER. But remember, the ER is there for you. So if you feel like you need more help than you have, go to the ER. What would happen? What would paramedics do if a patient passes out in front of them? All right, well, let's imagine two scenarios. The first is that the paramedics are on duty. If you pass out in front of them, the most important immediate priority is to make sure we prevent secondary injuries. If you pass out on the sidewalk and fall into the street, it's really important we get you out of the street so you don't get run over by a car. We don't want you laying on hot asphalt because you passed out. So the first thing we're going to do is we're going to provide for your safety. Then we're going to start assessing to find out why you passed out. Because medicine is not just treatment. It's the etiology. It's understanding why this condition is occurring so that we give you the right treatment. We don't want to just throw things at you. And in EMS, that used to be how we operated. We had something called the coma cocktail. We found you were unconscious, we gave you the coma cocktail. We gave you some sugar because maybe your sugar's low. Right? We give you Narcan because maybe you took too many drugs. We try not to do that anymore because that's bad medicine. You deserve for us to investigate the cause and treat it. Now, that investigation is also going to be looking for life threats. We're going to check your blood pressure, we're going to check your pulse, we're going to check your respiration, we're going to make sure your heart's working, we're going to make sure your lungs are working, and we're going to check things like your blood glucose levels. We're going to get you on the cardiac monitor, make sure that you're not having any abhorrent beats where it's causing sudden drops in blood pressure because your heart's missing beats and you're not getting the blood movement where you need it. Like I said, priority is making sure that you're safe, making sure you don't develop any secondary injuries, and then starting to assess and look for the etiology of what caused it. Now, the second scenario is that the paramedics are off duty. Now, when we're off duty, we're basically just civilians who know a little bit more medicine. Most of the time, we're not going to have any special tools. We're not going to have any. A lot of EMTs and paramedics will carry things like BVM. That way, if we do have to do CPR on somebody, we won't have to go mouth to mouth. Because even with that little barrier thing, there's always puke. And a BVM is so much better. So, we may carry little things like that, but we're not going to have diagnostic equipment. So, basically, we're going to do that first step again. We're going to provide for your safety. We're going to make sure that you're not at any risk for secondary injuries. And then we're going to check your vital signs. Make sure that you're breathing. Make sure you have a pulse. If you don't have those things, then that's when CPR kicks in. But short of that, if you pass out because you've been on the go all day, it's 106 outside for the 14th consecutive day in El Paso, and you're not drinking enough water, there's not much we can do for you. We're not going to have IV equipment with us. We're not going to do a hydration enema because I'm just not doing that. Even if it works, I don't care. I'm not doing it. No, I'll wait for EMS. I'll wait for the ambulance to show up. They can start an IV, give you some fluids, or give you some sugar, or give you some Narcan. But yeah, we're going to make sure that you don't have any life threats. We're going to make sure you don't get run over by a car. We're going to make sure that your heart's beating and that your lungs are working. And then we'll wait for the people with equipment to show up and take over for us. And we're back. What does an ambulance crew do if there is someone hurt inside a locked house that is too hurt to unlock the door? Now, how we handle this depends a lot on what we see, what dispatch information we received, what information we can get on scene. If we're doing a welfare check, then we might try to find someone who can unlock the door for us. If you called 911 and said, my chest hurts really bad, it feels like somebody's sitting on me, when I get to your house and nobody can unlock the door, I'm not going to wait to find a key. We'll try to be as nice as we can about getting in. There's a motto in the fire service, try it before you pry it. So a lot of times, check the side doors, check the back door. If that doesn't work, doors that have windows in them are easy to break through. I started out as a paramedic on a fire department, and on our ambulances we carried a Halligan tool, which is fondly referred to as a hooligan tool because you can use it to break into just about anything. So, you can pop locks on most residential doors. But yeah, again, a lot of the answers in EMS are going to depend on the situation. It's going to depend on the information I have and the situation I see. If I have dispatch information that you are severely injured, I'm going to get in your house as fast as possible because you're my priority. Your front door is not my priority. Your side window is not my priority. You are. Saving your life is the most important thing to me in that moment. If we're doing a welfare check where we don't have any information that somebody could be injured or there's no reports of an emergency, something like that, then yeah, we'll take the time, try to get in as gently as possible. And of course, if it's really bad, we'll call the fire department because they love to play with their K-12 saws. And if an EMS crew calls the fire department and says we need help on an entry, they will show up so fast because they get to cut into something. So, we'll get there. We'll save you. We'll do it as nice as possible. If a toddler came into the emergency room with a broken femur, would you suspect abuse? Have you ever heard the phrase, bouncing baby boy? There's a reason for that. Babies bounce. I mean literally, they bounce. Their bones have not hardened. Normally when they get a fracture, they get something called a green stick fracture, where the fracture travels along the bone but doesn't actually snap because the bone is very flexible. Now, in an adult, seeing a femur fracture generally indicates they went through severe trauma. I mean, you really got to hit it to break your femur as a healthy adult. When you get into older age, hip fractures are pretty common. But, talking about a healthy adult, breaking a femur is pretty impressive. So for a toddler to do it, it does indicate that they suffered a severe traumatic insult. That doesn't mean it was on purpose. It doesn't mean it was neglectful. It doesn't mean it was intentional. It doesn't mean it was abuse. But it does mean that they suffered a lot of force. So we have to look at it and say, what caused this force? We have to look at the child as a whole. Everything in medicine is the situation. It's the scenario. It's what's in front of you. All right? If the physician in the ER orders a battery of testing, nuclear imaging comes in, they scan the kid head to toe, and there's no other signs of fractures, we're going to undress the kid. We're going to do a head to toe evaluation. There's no signs of healing bruises. There's no signs of other damage. A single traumatic insult to the degree to break a femur as a first-time abusive measure can absolutely happen. It doesn't normally. normally abuse escalates. Again, just because it happened the first time doesn't mean we're going to discount abuse. But it's if we don't see anything else, that whole picture, if we don't see anything else in that picture that says, hey, there's something going on. We don't see other forms of abuse, malnutrition. We don't see a child who's afraid to engage with adults. Then it's going to be less and less likely that it was abuse. Again, abuse can also occur in the form of neglect, where a child was unattended and they fell 2 floors and broke their femur. That can still be abuse, but that's not for us to decide. But as far as regular systemic physical abuse, on a single injury, it's not going to be likely to be at the top of the differential diagnosis. It's going to be there, but it's not going to be at the top. If we undress the child's afraid of adults. We undress the child. We see bruises in various stages of healing. Nuclear imaging comes in. They do scans. We see other small fractures that are in stages of healing. Some parents go into jail because they goddamn deserve it. Yeah, I have like 2,000 views. I don't have to worry about being monetized. But a single traumatic insult does not abuse make. Hey, so I'm new to this whole thing. I kind of forgot that whole outro thing. So, if you enjoyed it, maybe subscribe or like it or comment or don't. I mean, I'd like you to do those things, but I won't judge you. Sometimes people just have better things to do. I get it. It's cool.